slit photo of the lens.
Eight more seconds to go.
हो गया? Anyone? कोई एक आंसर तो करो. It can be wrong. It is okay. What is the likely axial length? Is it millimeter, 28 millimeter, 34 millimeter, or 31 millimeter? What does book say about it? There is an apathic patient who is seeing 20 by 20 without glasses. So what is the likely axial length? Do not. डन है ना? ठीक है. Pericardial anesthesia, posterior subtension triamcinolone, arrange viscode, arrange capsular tension ring. There is something in the photo. So which precaution, even if you do not take it, might not matter. So pericardial anesthesia, CTR, posterior subtension triamcinolone, viscode. डन है ना? हाँ. 15 seconds. Mic. So what would be the answer?
So Mr. Jawada, this is PXF, pseudo exfoliation. We will have to like the pupil will not dilate in this case. We will have to arrange the capsular tension ring and we will have to bring for the visco, but there is no indication of subtene or triamcinolone.
Yes, excellent. So these cases will increase the safety of the surgery because the eye will be anesthetized and immobile. That's also. So what is the most likely mechanism of elevated IOP in this patient? Trabecular network obstruction by melanin dispersion, angle closure due to past neovascular glaucoma or elevated episcleral venous portion. Some radius discoloration on the face which patient has this seizures, epilepsy. So unilateral in a 32-year-old female with iris finding. Okay, na timer. So anyone who has not responded? Excellent sir, thank you. Chocolate pointing towards IC syndrome. ठीक है, next. So ये कुछ है, ये थोड़ा मैग्नीफाई में दिखना पड़ेगा. इंफीरियरली आइरिस के मतलब प्यूपिल के इंफीरियरली आप देखिए कुछ रेडिस डिस्कलरेशन है. तो इन विजन भी कम है. 52 प्रेशर्स, विजन इज 3/60. ट्रैप प्लस एमएमसी करेंगे इनिशियल ट्रीटमेंट के हिसाब से या ट्रॉपिकल पीजी एनालॉग, ओरल एसिटाजोलामाइड एलोन और इंटरवेंटल एंटी-पीजीए. What would be the most appropriate initial treatment? Pressure is 52.
Is the correct answer because neovascularization is there.
क्यों? Why not other options? Why?
Option would have fallen.
अच्छा ठीक है मैडम को प्राइज दीजिए. मैडम का एक है मतलब
सुजाता पाटिल, assistant professor and KCC.
Excellent, thank you. बेसिकली नहीं, दिस इज मतलब यू कैन नॉट गो डायरेक्टली फॉर ट्रैप एंड एमएमसी. आईओपी कंट्रोल करना पड़ेगा. ट्रॉपिकल पीजी एनालॉग कैन इंक्रीज लाइक ऑनवर्ड बाय पीआरपी वुड हैव बीन अ बेटर आंसर बट वी ये बेसिकली थोड़ा इट इज ट्रिकी क्योंकि हाँ नहीं वो तो है. बेसिकली जो भी ऑप्शंस है उसके अंदर आपका क्या व्हाट इज द बेस्ट पॉसिबल आंसर. यस
we know that everybody is very brilliant but like
so ये पेशेंट है ये टॉपिक में ले रही थी तो रिफ्रैक्टिव एवरेज -4 डायप्टर. क्या आप करेंगे इसमें? लेजर पेरिफेरल आइसोटोप, टॉपिकल पाइलो, स्टॉप टॉपिरामाइड एंड स्टार्ट एट्रोपिन और सिस्टेमिक मैनिटोल and topical hematocrost, which would be the most appropriate immediate management. So what will you do and what will most likely benefit the patient? So we'll give, because there are many more things to cover, we'll give 30 seconds from now on. Any response?
Block due to the subluxated limbs and posterior synucleus after that.
Yes, later.
Yes, after that.
Posterior synucleus. So what is the diagnosis here? 7-year-old boy. 7-year-old boy with bilateral nystagmus, pressure भी ज़्यादा है, bilateral cataract with bilateral superior lens. Answer will be angle dysgenesis and progressive obstruction. That will be the answer. It is a case of angle TIA.
Okay, sir.
ठीक है, thank you. Broken and matted jonular fibers. What is incorrect or false here? इसके लिए time.
Then Rutayani, she is in position number 3. Give her a very big hand. Then Dr. Singh. Dr. Singh. Oh, Ankur. Okay, चलो.
सिंह नहीं बोलना, सिंह जी बोलना.
अच्छा ठीक है, इसमें लिखा है. चलो ठीक है. और डॉक्टर अंकुर is our special guest. Very big hand for him. Then Soumya. Soumya is in position number 5. So why I am telling this because we will invite 8 people to come for the final round. So we have 5 more questions.
Dr. Chittaranjan Sardar should be called Sardar. They should be called Sardar Ji. ठीक है, कभी भी सिंह नहीं बोलना.
Sorry Shaktiman. Sorry Ankur ji.
This device. 30 seconds तक लगता है. This is a easy question is. पहले जूनियर क्यों ऐसे बनाया हुआ है? Why is this like curvy thing? ठीक है, सबको प्राइज दो. और उसमें दिखाया हुआ है तो it is dividing the nucleus. So who invented this? David person who invented this instrument. This is dividing the length of something.
15 seconds more. Whenever it comes to the screen, the timer starts from that time. ठीक है.
Myself, Dr. Ruchira from MKCG.
ठीक है. He is feeling very sleepy and lethargy. He is not getting up. So after putting some drop. So please do not prompt. Photo. What test will you do to diagnose this? Blood for hexocyanosis A, carotid Doppler, ESR and CRP, genetic test for RP65. Which test would you do if you find similar fundus finding in both eyes? If I has something else which might be related also. This is the last question. आपको डालना था 20, आपने गलती से 23 डायप्टर लेंस डाल दिया. तो how much refractive surprise you might expect from this? 1 diopter, 1.5 diopter, 2 diopter or 3 diopter? Huge, many prizes here. So any person who has not responded before, please try. There is nothing to lose. We are here to learn. 2 diopter. So we are finished. Let us see the check at the.
I am PG third year from MKCG Medical College, Colombo.
Your resident, post PG, and I'm from JPM Rotary. I've just completed my DA.
Working as an assistant professor in civil medical.
Mahesh Kumar Sahu, a second year PG from Himsa.
So this is certain drug. What is the indication? FDA approved drug. Is it diabetic macular edema? Is it dry eye disease, repeated eyelid blinking or geographic atrophy? Dr. Sonali. So ये कुछ drug है. What is the indication for this drug? Fizz, aceclidine. ये XDEM भी है. What is its indication? Dermatochalasis, demodex infection, dermatitis fungal corneal ulcer or contact dermatitis of the eyelid. What is this drug used for? Lotilaner.
Pass. Dr. Samir
From? Thank you. Geographic atrophy, CNPM, retinal pigmentosa or MACTEL. Encelto.
Myself, Dr. Sitaram from SDH Chhatrapur.
Excellent, sir. Thank you. Good. So, Dr. Shadab. So, ये आइजर भी बोल के कुछ है, एबासिन कैप्टेन है. What is the indication? Geographic atrophy, CNPM, retinal pigmentosa or DAB? Dr. Shadab. FDA has recently approved this. Not available in India, but we are looking forward to it. -10 कर दीजिए तो ही PSCG, hypochromic iris or hypotrichosis of eyelash. This is certain drug. What is the indication for this drop? नहीं ये नहीं बोल पाएंगे बाकी. अच्छा, it should be done. The A constant is 150.3. The IOL is placed properly. What is incorrect in this? This is a simple question. Any cataract surgeon should be able to answer this. Plus 10, नहीं 10 second हुआ. Plus 10 minus. Correct. क्यों? No, not horizontal. This is like S. So ये उल्टा डाला हुआ है. ACIOL has a vault. So this is उल्टा. Dr. Shubhan. Plus 10 and minus 10. So टेक्निस्टोरिक में कहाँ पे सिलिंड्रिकल पावर डाला हुआ है? To put multi-piece IOL in sulcus without optic. So 20 diopter का लेंस था. अगर A कांस्टेंट सेम रहता है तो आप कितना पावर का लेंस डालोगे?
Reason why we have more anterior segment surgeons
is because both number of institutions providing segment training is less.
it could also
demand is equal to supply. Demand is equal to supply. That's why, as because the demand is more for anterior segment training.
Because the demand is more and the supply is more.
No,
It has got nothing to do with money.
You have taken it wrong, dear. He was telling why more training centers. That's what I told. It is not about the number of surgeons.
Can we go to the audience? How many of you feel that the anterior segment surgeons are more in the anterior segment? And while retina is also doing anterior segment.
Okay, so we safely conclude that money is always a byproduct. People who are
You are saying
Yes.
you are always sitting on the fence. Always.
Six, nine.
Santosh, I beg to differ on the financial lucrativeness. Now retina is a more lucrative thing because one injection versus one finger, you get 10 injections in that time. No. It is more lucrative posterior segment. Most of our fellows are posterior
That's why more
are rich, then it is actually the
judge is going to collapse with laughter. Please be a little kind on the judges, yeah? You can't do that to them.
we are just a touch soul rich than financially rich. We are rich with our souls. We are happy just because we are able to serve.
Years back when I was a postgraduate student at RIU Kolkata, with 30 cataract operations in a day, Professor IS was not ready to give one operation to us. We all were discussing how much thirst is there for cataract to Professor IS, my teacher. Still he liked to do so many cataract. And he used to say every time, I like to do cataract surgery. It is my real thirst. It is my real food. So that's why you don't take everybody that they like to do cataract surgery and anterior segment surgery only for money. But the simplest surgery giving immediate result with good vision give them mental satisfaction. And that is going on for years together, starting from the days of phonography and still today. So with this I think we will go on.
Hello, look.
Asantu. Thank you.
Sir. One look.
Now, he's a great Aconian from Odisha.
I am having a state of lesson.
Yes.
Touch you.
So,
in our tertiary centers. So thank you all.
So as a Aconian, I am very much satisfied. They given the services. The oldest person, I have shown the figure. This is the 105 years old lady done the cataract surgery. Another is 101 years. So Aconian also giving a good platform for recognition in the nationwide. That's why in this platform I would like to thank with the particularly the steward, Sopanasya, PH had helped so much to recognizing us and why. So finally, together we can ensure no one left in the about the equity. Thank you.
10% of what we read, but we remember 90% of what we say and do. So if we involve all our senses, then the learning is good. Now the blackboard is the traditional method of teaching that we have all learned from during our childhood. So we all remember the teachers calling us to wipe up the blackboard. At that time we felt like we are the teacher's pet. Okay. This is one example in Africa when there is no person teaching something that is digital. Waste were used before. This is in 2006. So I am here describing the extraocular muscles here. You can see this space and making various models. Also while doing that we enjoyed ourselves a lot. So and then came now the era of PowerPoint presentation. Okay. Now it gets attention of the students. We can make it fun, humorous, colorful, so that the student or the audience is not sleeping there. So this is not really needed. There is some bow ties before we do our surgeries on the patients, so that there is more confidence and more fine tuning of the hand movements, so that the complications of patients are reduced. Also there are dry lab, there is no financial interest for these things. We have phacoid, where the phaco can be practiced, the laser eye where retinal lasers can be practiced before the students can go to do it on the patients. There are also many DIY innovations, the operation theatre and operate on the patients. So we have to choose the appropriate media to teach. Each has its own strength. Now the media cannot compensate for a poor student.
So we are not going into the science of it in this particular talk. I am just trying to explain to you the methodology, the objective, the purpose behind it. We are not discussing what were the findings of the course. I am just trying to introduce you the concept and the motivation and the journey behind the course. And because we were not able to identify a opinion or the guidelines from the course study, we decided to set up this OSOCON in 2018-2019. Once again we gathered this team in 2018 in PGI Chandigarh, wherein all this bunch of people who call themselves as a specialist, they all came together. Again, a very unique way to set up into different teams. Setting up this question itself is an innovation. So what is innovation? Innovation is to interpret in a running clinic. You're running a clinic, you open a chart, probably not so easy. I was not satisfied, and though we published this chart in the form of a digital calculator. So my appeal to all those glaucoma specialists, all those cornea specialists, all those medical retina specialists, why don't they convert their complicated papers in...
To the next question. Cause of ring scotoma. Yes. Stand up. Retinitis pigmentosa. Absolutely correct. So you're selected. 14 selected. Am I right? We still have 4 to go. Literal meaning of staphyloma. Yes. Bunch of grapes is the right answer. The one who could not answer, now you can come into the game. Okay? So how many teams do we have? 5 teams? Yes. You can answer now. I hope you had your breakfast. Exophthalmometer. How many teams do we have? 6. 2 teams to go. Most common type of color blindness. Yes, red and green. See, the questions are very easy. It's just blowing the whistle. We have 6 teams, 7 teams. 1 more to go, the very last question. Alert all of you. I thought there would be a whistle by now. What's wrong with you guys? Oi! Yes? Shall we go to the next question since the answer was given out, or shall we go with her? But you still need to speak for 1 minute.
Okay, an ideal marriage, like I think I'm blind and my husband is dumb because whatever I speak, so he is just not, nodding at head. He doesn't listen, but he pretends to listen to me, and whatever mischief he may, I cannot tell in front of the public, so I keep my eyes blindfolded. So.
Have you covered 1 minute? You need to cover 1 minute. You need to talk for 1 minute. Otherwise you lose marks.
Okay, so I think everyone's marriage should be like this, and I want everyone's, all the females to be blind and not seeing to what their husbands do, and I want all the husbands also to be dumb and do not listen to what your wife blabbers. So, is it not yet 1 minute?
Is it 1 minute? His wife's best friend is not here. His wife's sister or anyone is not here.
It is a better situation from the past situation. If the wife
Put the mic near your thing. Here you don't need to be dumb. It's okay.
better situation from the past condition. If the wife is blind, wife is dumb, she will not tell anything. If the husband is blind, he will not see anything and don't tell anything to the wife. So there will be a good harmony, then we will go prosper in life.
1 minute. You have 1 minute. Come on, come up with all the conditions.
If the audience also will be like to follow this, so that the marriage year type is married life will be happy. So this condition is better than the people.
The one topic twice and you say that is enough for a
Sir, if the awardee is not here, can somebody collect it? So anybody from same institute? And Professor Dr. Kulamani Mishra Award for Refraction Electrical Apparatus goes to Dr. Professor Dr. Vimolakanta Tripathi Award for Oculoplasty goes to Dr. Bigyan Ponda. Lokchan Netralaya Best Video Award, Dr. Devi Aishwarya Das. Clap, clap, clap. Professor Dr. Vijay Kumar Sir.
मैडम एपड़ देखो मैडम एपड़ सर 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 एपड़
Clap, 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 clap. The second prize goes to Dr. Bhagavat Naik and Dr. Parishankar Patra. Very sad. Consolation prizes go to Dr. Priyadarshini Mishra and Sikha Mishra. Can anyone collect for Dr. Lipsa Sahu? Session, Institution on Fire. The best team. Big round of applause for Jayalakshmi. Dr. Santosh Kapatra.
Set the house on fire. आरटा दोन सर
एडा मिस करियो वाले पड़ेला
जब से जो अत्याचार थी हां ना टीम में एटा पटल
छोटी के दिया
हां सर अपने पड़ला सर अपने ताकि हां
The best debate.
Good.
Best debate वाला ये बेस्ट
Dr. Ankita, Dr. Devi will collect her award.
I thank all the members of LSC who have worked so hard and such a nice conference, food, scientific activities. Please give a big hand for the local organization. Unbelievable nice conference.
Good minute.
As I said earlier, come with smile and go smile. And maybe some shortcomings will be there, very minimum. So let us sportively take it, and what are the shortcomings in this conference that is rectified for the next conference. And on behalf of LOC, I want to give a moment to our president, ex-president, past president, and CSC. Come here. She has done a wonderful job. Untiring job. Anytime, give a call, she will pick up. A good auditor also. Auditor architecture past year. वो बड़ा इसके बैग में है। अरे यार भाई काम करवा रहे हैं। वो काम करने के लिए आया है। बस नहीं। I will submit the accounts next month.
Please account to come in the next account, verified account.
So,
this is the bride. So this is the bride. Very small. Don't act.
Actually, for my accurate assessment of things, exactly. I have accurately said that 350.
Oh.
Yeah.
Sir, आगो टिके देखन sir, look.
Sir. Yes. May I request our treasurer to come and collect the treasurer? Thank you. Yes. Treasurer on demand. You come. On demand. So you done a wonderful job in the election process. You come. Jai Shri Asad ke Jai Shri.
Sir, upon the reported
Sir, एपड़े look.
Apart क्या है?
Sir, एपड़े look.
आप कितना अच्छे से?
साथ में young है कि थाम तो आओ
This should join. No. I am the joint secretary here. Shweta is not there, but Savita is there, and our treasurer is there.
Come on.
Sitaram.
On behalf of
Sitaram is my treasurer.
सविता को ऑर्डर दिया से बहुत काम हो
Yes. Asa.
अच्छी जी
So dance पे मैं they have
Asa. Sir, upon you.
आगो टिके front पळे आसुन. एपड़ टिके look.
And all the dancing team, please come over to the stage. The dancing team. Here,
leader is important, na?
Welcome.
and I suggested that the next IJOC conference to be allotted in Odisha, then we had here. Beautiful halls, 650 member auditorium, and so many places to see, and Gopalpur Sea Beach.
Yes.
So next IJOC we should try here.
Yes, sir. Yes.
And of course, as happened in this time, he should not be burdened so much. I want others to cooperate and relieve the burden.
That is instruction. I said,
Samita, that ramp walk stole the show.
So for the ramp walk, this is for the ramp.
Okay, yeah. Ramp show lovely team show.
Very extensive.
Exactly. Joe, sir.